We found out a couple of hours ago that Emmanuel Macron, the president of France, actually tested positive. He is the third leader of a G7 country to do so. Does that usually change public policy towards the virus? Did it change anything when President Trump got it?
I think I was there, excuse me. So the short answer is no. In the United States, it actually emboldened people who said, oh, look, the virus is not really serious. The president bounced back quickly and ultimately received treatments that would not be available to the general public in doing so. So it's hard to say. I think with Boris Johnson, we saw the public pay close attention, particularly here in the United States. That caught everyone's attention. With Macron, it will be interesting to see what the French people feel after they see his recovery period.
How are the vaccines doing in the U.S., Jason? So we had a couple of people actually reacting badly because of previous allergies or even because they didn't have any allergies. Does it make it less people, or does it make it that less people will want to have a vaccine?
Yeah, so we're in the public health community, we're very concerned about what we call vaccine hesitancy, meaning people being fearful of taking the vaccine. As I've spoken for before on this program, in full disclosure, I am a vaccine candidate participant in a research study, but we are seeing, we just saw a case of anaphylaxis or allergic reaction in Alaska among a healthcare worker who received the first dose of vaccine. But importantly, there are safety measures in place. Once we give a dose of vaccine, we have the individual wait for at least 15 minutes to ensure that there is no anaphylaxis or allergic reaction. And if there is, we have clear protocols in place to address it. Importantly, we don't yet know exactly what component of the vaccine results in anaphylaxis. So the FDA recommended that individuals with a history of severe allergic reaction not receive the vaccine at this time.
Jason, some of the figures that you sent through are absolutely shocking. Approximately one death in the U.S. every 36 seconds at the moment. Is this a new strain? There was talk, at least in the U.K., that it could be a strain of something that's actually spreading quicker. Any truth in that?
So there have been several analyses and studies that have evaluated the mutation patterns of the virus. And all viruses, when they have this level of penetrance in the community or transmission, have some level of mutation. And there are a couple of genes that have demonstrated the potential for increased transmissibility. However, those same genes in the full genomic analysis of the virus have not shown increase in morbidity or mortality. So while there is some debate right now in the scientific community about whether or not these mutations are leading to potential super spreader events, they do not seem to be associated with greater morbidity or mortality at this time.
Can families safely gather for the holidays?
No. We've seen from the Thanksgiving holiday here in the United States that it has been a key driver of our increased cases since that time. Exactly as we predicted, 10 to 14 days after the holiday would be a huge surge of cases. And we are seeing exactly what the epidemiologists predicted, which is huge capacities, not being able to meet the need and the load of patients at various sites. Here in Baltimore, we have opened our field hospital again and are needing to send patients from our emergency departments who don't seem like they need admission directly to our field hospital. So it is an extremely important issue, and I highly recommend all families consider strongly not traveling and not visiting for the holidays.